Treat port wine birthmarks, also called nevus flammeus, early to avoid progression. A nevus flammeus, or a port wine stain, commonly known as red birthmark, is a common congenital benign vascular malformation with an incidence of 0.3% to 0.5%. In newborns, it often appears at birth or shortly thereafter and is common on the face, neck, and scalp, but can also occur on the limbs or any other part of the body. It is mostly unilateral, but occasionally bilateral, and sometimes involves the mucous membranes. If treat port wine is not treated in time, there are usually several consequences. Enlargement of the area. As age increases, the area becomes larger, the color becomes deeper, and the degree of disease becomes more severe, such as thickening or nodules, etc. In severe cases, it can cause deformation of the patient's facial features and limbs. Ulceration and infection. Treat port wine is caused by vascular malformation and occurs in the epidermis and dermis. It is easy to ulcerate and bleed, and the tumor body is prone to ulceration and infection. Mental damage. Treat port wine mostly occurs in obvious positions on the face, seriously affecting the patient's external image and causing serious impact on the patient's mental health. Organ damage. Treat port wine on the face may cause neurological abnormalities such as glaucoma. Treat port wine on the limbs usually endangers the entire limb to become hypertrophic. Currently, the main treatment methods for treat port wine include laser treatment and photodynamic therapy. At present, photodynamic technology has developed for decades and has a certain degree of therapeutic effect on various diseases. For example, Photofrin, porphyrin sodium injection, initial U.S. approval by FDA, 1995. Can be used for routine treatment of various cancer diseases. Photodynamic therapy for PWS is an effective treatment method. It is vascular targeted and can selectively destroy abnormal capillaries to prevent recurrence and is still effective for patients who are resistant to lasers. In clinical statistics, the total effective rate of photodynamic therapy for PWS patients is about 89%, and the basic cure rate after 2 treatments is about 20%. At present, no patients have reported recurrence during postoperative follow-up. Photodynamic therapy, PDT, is a drug/device combination therapy technology, and its current application level after systemic or local administration of photosensitizers followed by irradiation with a specific wavelength light source, wavelength 523 nm, looks like green, fixed position irradiation for 20 minutes. The photosensitizer in its ground state absorbs light energy to convert surrounding molecular oxygen into singlet oxygen, reactive oxygen, which has oxygen toxicity and can oxidize surrounding organelles and biomolecules to cause cell death, apoptosis, autophagy, vascular damage, etc., thereby eliminating port wine stain under the skin of the affected area. At the end of the video, thank you for coming to my channel. The blogger is a person with real experience in treating port wine stain. The purpose of this channel is to introduce the symptoms of port wine stain and the latest and effective treatment methods. I hope that patients can get rid of the physical and psychological impact of port wine stain as soon as possible. In the next video, I will continue to introduce the working principle and drug development history of photodynamic therapy for port wine stain. Please follow our channel. Thank you.